Human reproduction. 3. Topic: pregnancy. At the end of the lesson, the student should be able to explain the meaning of the term pregnancy, mention 2 ways by which pregnancy can occur, list 4 symptoms of pregnancy, explain growth of the fetus stage by stage. Pregnancy is the state of carrying a developing fetus within the uterus, also known as the womb, in a female's body. One or more fetus may develop inside a woman's womb. Pregnancy is indicated and confirmed by positive results from scanning and pregnancy tests. Explain the meaning of the term pregnancy. It is a state of carrying a developing fetus within the womb in a woman's body. 2 ways by which pregnancy can occur are vaginal intercourse and assisted reproductive technology, commonly referred to as test tube baby. Mention 2 ways by which pregnancy can occur. The 2 ways by which pregnancy can occur are 1. Vaginal intercourse, 2. Assisted reproductive technology. Symptoms of pregnancy. Symptoms of pregnancy include the following: menstruation will stop, the breast become fuller and tender, that is sensitive, constipation will be experienced, that is inability to digest food properly, nausea and vomiting, especially in the morning, and is simply referred to as morning sickness, frequent urination, fatigue and exhaustion, that is a pregnant woman gets tired easily, which can make them sleep. Mood swings. A pregnant woman reacts negatively to certain ways by which, in the process of trying to interact with others, may show certain negative response that can make the person he or she is interacting with to feel somehow bad. But it's not the fault of the pregnant woman, it's just the hormone responsible for mood swings. The mood changes gradually. A pregnant woman will experience back pain, swollen feet, spotting, that is certain discharge of blood that will stain her undies. She develops food dislike. She may not like eating certain food. Signs of pregnancy. Signs of pregnancy include the presence of hormone in the urine, development of the baby in the womb that leads to protruding tummy. She gains weight, and the pregnancy belly is conspicuous, showing gradual development of the baby in the woman's womb. Stage 4 symptoms of pregnancy. 4 symptoms of pregnancy include absence of period, mood swings, spotting, swollen feet. One of the following is not a symptom of pregnancy. The correct option is option D, inability to urinate. The second question, an unborn baby is called fetus. The correct option is true. The fertilization of the female ovum or egg by the male cell or sperm forms a zygote. The correct option is true. Pregnancy test and advice. The best place to go for pregnancy test and advice is the hospital or healthcare center, and not unqualified self-acclaimed nurses and doctors. Pregnancy can be confirmed by blood or urine test or ultrasound scan. Stages of fetal growth and development. After fertilization, that is the fusion of the male and the female sex cell nuclei, to form a zygote. The fertilized egg is implanted in the womb, also known as the uterus, and it develops to form the embryo, which develops gradually to form the fetus. The fetus grows in the womb until delivery, that is, birth. Pregnancy goes through 3 stages. Each stage takes 3 months and is called a trimester. The first trimester signifies the first 3 months of pregnancy. The placenta is formed to provide the fetus respiratory gas, nutrient through the umbilical cord, and waste products are removed. All major organs begin to form. The baby's heart begins to beat. The arms and the legs grow longer. Sex organs begin to form, and the face begins to develop features. Second trimester. This is the pregnancy period between 3 and 6 months. This stage is more stable than the first trimester, and it is indicated by the following. Baby will become more active. Second trimester. This is the stage. Second trimester. This is the second trimester. This is the pregnancy period between 3 and 6 months. This stage is more stable than the first trimester. Baby is more active. Eyebrows, eyelashes, fingernails, and toenails are formed. Baby can hear and swallow. The musculoskeletal system continues to form. Sucking reflex develops. Bone marrow begins to make blood cells. Taste buds are formed. Footprints and fingerprints are formed. Lungs are formed but do not yet walk. Testicles begin to descend into the scrotum in male. If it's a girl, her uterus and ovaries are in place, and a lifetime supply of eggs are formed in the ovaries. Third trimester. This is the pregnancy period from 6 to 9 months. Baby's organs are capable of functioning on their own. The eyes can open and close. Lungs are not fully formed, but breathing movement occur. Baby may turn into a head down position for birth. At the end of this trimester, the mother enters into labor and the child is born. The diagram shows the 3 trimesters, making a total of 9 months. The first trimester, the second trimester, and the third trimester. This diagram shows the 3 trimesters, making a total of 3 times 3, that's 9 months. The first trimester covers the first, second, and the third month, while the second trimester covers the 4th, 5th, and 6th month, and the third trimester covers the 7th, 8th, and 9th month, and delivery will now take place. Each stage of pregnancy lasts for, the correct option is 3 months. The stages of pregnancy are referred to as, the correct option is trimester. Effects of drug abuse during pregnancy. Drug abuse is the consumption of drugs not prescribed by a medical practitioner, and drug abuse is common among everybody. Even pregnant mothers abuse drugs. Drug abuse affects the pregnant mother by the following ways. It can lead to miscarriage. The baby will be affected, and that will she will now give birth to a baby with low birth weight. The baby may die in the womb, and it also delays developmental period or processes that occur in the womb. Behavioral and learning problems may be established in the developing baby after birth. The baby may experience low blood sugar level. The same thing the mom. Premature labor and birth may occur, Breathing difficulties of the fetus may also occur. State the effects of drug abuse during pregnancy. It leads to low birth weight. It can lead to low blood sugar. It can lead to miscarriage. Which of the following is not the effect of drug abuse on pregnancy? The correct option is safe delivery. Birth defect. A birth defect is a problem that occurs while a baby is developing in the body of the mother, mostly in the first 3 months of pregnancy. Birth defects include malfunction of body parts, how the body takes in food for energy. Causes of birth defects: abnormal chromosome 1, use of alcohol. 3, environmental factors. Environmental factors include the weather, lack of good diet, lack of good rest. Infection. Baby also develop defect as a result of exposure to certain infection in the womb. Prevention of birth defects. Some birth defects can be prevented in the following ways: taking folic acid to help effective growth and development of the baby, attending antenatal care meeting where doctors can prescribe drugs to use and diagnose many birth defects if the womb. Prevention of birth defect. Some birth defects can be prevented in the following ways: by taking folic acid to enhance effective development, by attending antenatal care where doctors can prescribe drugs to use and diagnose many birth defects in the womb. 3, avoiding taking alcohol during pregnancy. Consequences of birth defects. Consequences of birth defects include the following: feeding problems, difficulty in breathing, hearing problem, seizures. This is an uncontrolled electrical activity in the brain which may produce a physical convulsion. Physical challenge such as inability to walk, talk, and see. Fibrosis, the thickening and scarring of the connective tissues. Thank you for listening.